Yes, I could see many hands raising. So what do you do? I think you have a topic in textbook as well, science textbook, how to deal with nose bleeding or epistaxis. No? Okay. I have seen in CBSE textbook of my daughter who was in class 6. So when you come across a patient with a nose bleeding, what you have to do is ask the patient to lean forward. First give assurance, ask him not to worry, ask him to lean forward and pinch the nostril below the nose bridge. This is the nose bridge. Here you have to pinch it. Why do you pinch? Why do you apply pressure when a patient is bleeding? To stop the bleeding, by applying pressure, the vessel there gets constricted. When it is constricted means it becomes narrow, so it will not pump out the blood. In the same way, when you are applying pressure, the vessel there gets constricted and it will stop bleeding. So you have to pinch the nostril till the bleeding stops. So once the bleeding is over, then never blow the nose hard. Why? So body has got a wonderful mechanism of formation of clot. Whenever there is a bleeding, you see, many of you will be having small cuts and start bleeding. Will it be bleeding continuously? A clot forms. That is the nature's protective mechanism. Our body has got many protective mechanisms. One of them is clot formation. So while the patient is having nasal bleeding, there is a clot which is going to stop the bleeding as well. When you blow out the nose fast and hard, you are going to dislodge the clot. Ultimately what happens? Again, the block is open and the vessel starts spurting out. So, these are things which you should not do after the bleeding is stopped. And again, do not ask the patient to lean back. Only ask him to lean forward, not back. Why not back? When the patient leans back, all the blood which is coming will be going into the lungs, aspirated, and it will become another problem. Along with epistaxis, he will be also going to have lung problem also. So always ask him to lean forward only. This is again asphyxia, which Dr. Rajkumar has already dealt with, but I am going to talk few words on this as well. What is asphyxia? Something which is blocking means one of the respiratory problems. We have come across heart problems till now. This is of lung. So the lung will not be getting adequate supply of air in certain situations. One is choking. So how do you know if the patient is choking? I have given the symptoms here. Blue discoloration of face, tongue and lips. Why do you see blue discoloration? Why blue discoloration?
All the blood from his face and all his brains.
Why blood is stopped? It is in the windpipe, where from blood has come into the scene.
And the oxygen in the blood just goes away.
Partly correct. So there is a block in the windpipe. So you are not getting air into the lungs. Lung is the structure which makes the blood oxygenated by supplying oxygen to the heart. Deoxygenated blood goes into the heart. It gets cleared by lung. Lung is the one which supplies oxygen. When you are blocking the windpipe, there will not be adequate oxygen. So deoxygenated blood is blue in color. Check your veins. You have veins here. Check your veins. What color are those? Are those dark or bright? Dark in color or bright in color? Yes. These veins are carrying deoxygenated blood. Arteries will be carrying oxygenated blood. So the entire thing will be filled with deoxygenated venous blood. That's why there is bluish discoloration of face, lips and all. And classically the child or the patient will be holding this way, like I am unable to breathe or speak. Okay. So, if you do not address immediately, if certain amount of time is crossed, the patient becomes unconscious. Then comes your role of CPR again. So, this is the picture showing a victim who is choking. He is not able to talk, groan. He's here. The patient is able to talk to an extent, and he is like coughing vigorously. Why do you cough? What is the purpose of cough? This is again one protective mechanism of the body. Cough is cough or sneeze. Sneeze is when some foreign particle enters the nose. Sneeze. You sneeze, trying to expel out the foreign body in the nose. Cough is something when some foreign object blocks the windpipe, then the body tries to expel it out by coughing. So here the victim has partially choked foreign material inside. So he is trying to cough it out. It's an involuntary thing. So he is partially choked. If it is completely choked, he will not be able to cough out or breathe, talk or anything. So in this case, first and foremost thing is remain calm. You have to be calm and ask the victim also to stay calm and encourage him to cough it out. First, ask him to try to cough out as much as possible. He is not able to cough out. Then comes your then, what sir has shown before, you have to stand behind the patient, then support their chest with one hand. Ask him to lean forward. Support with one hand. And with the other hand, you have to give at least 5 sharp blows between the person's shoulder blades. These are shoulder blades. Between the shoulder blades, you have to give 5 sharp blows. Okay? When you are giving blows, what happens? The foreign body tries to come out. So keep checking in between. If the material has come out, ask him to cough out. Then the most important thing which you have to not do in choking is never try to put your finger and pull the object out. Why? Why should you not do that?
Bacteria enters.
No, bacteria is a minor thing. Here the patient is dying. Forget about bacteria. We can treat it later with some antibiotic.
Ma'am, if we keep the finger in the throat, they can throw up and the choking will be more dangerous.
Yeah, you may be, without your knowledge, you are trying to help the patient, but you may be pushing the object inside. When trying to pull it out, it may go inside furthermore, and the partial choking may become complete choking also. So, never try to pull it out that way. Okay, now you gave 5 blows between the shoulder blades. Still, the object has not come out. Now you have to give abdominal thrust, that's Heimlich's maneuver. Okay, this is a scenario of complete choking. Here the patient is not able to talk or breathe or anything. Here you have to try with Heimlich's maneuver directly and never put the finger again. This is a classical presentation of Heimlich's maneuver, how to do. Here, sir has demonstrated excellently. Make fist with one hand and cover with the other hand and above the belly button. Where you have to give pressure above the belly button, below the ribs. Then this way you have to give upward thrust so that the object comes out. Okay, inward and upward thrust. With fist, one hand is fisted, the other will be covering the fist, and the fisted hand will be pressing the abdomen above the belly button or below the ribs. This is the infant. When you are coming across an infant, this is how you have to hold the infant with the forearm like this and give thrust between the shoulder blades. Okay? Then you are alone. Nobody is there. Choked. No help. What you will do? The last picture shows that take the support of some chair or hard object, lean towards it and try to apply abdominal thrust by yourself so that the object comes out. Yeah, fainting. I heard some of you have fainted in the morning. Is it true? Yes. So, why do people faint? What causes fainting? Why did you faint? Why did the kids faint in the morning? Lack of water. Okay. That is hypotension. One more reason. Any other reasons? Not eating properly. Hypoglycemia. Next. Yes. All these situations, what happens? Fainting. Why the patient faints? So, decreased energy levels to the brain because of lack of glucose, blood, oxygen, anything it may be. So, the person he feels like giddiness and collapses on the ground. So, conditions which cause fainting is it occurs because of temporary decrease of blood flow to the brain. You said lack of water. So, in lack of water, the blood volume is reduced automatically. And when a patient, you have heard of heat stroke as well, no? When they are walking in a sunny area for a long time, they go into dehydration. The blood volume inside the body is decreased. Subsequently, the blood supply to the brain is decreased. Then, which can be caused by not eating properly, as you said, hypoglycemia. Standing up too fast. What happens when you suddenly stand up? Yes.
All the blood that is present in the brain suddenly goes down.
Okay. So blood tends to go into dependent areas. When you stand, no, this is not dependent area. Foot is the dependent area. So when you suddenly stand, no, the blood supply to the brain is reduced. Or low blood pressure, that is hypotension. So what happens? The casualty, the sufferer feels faint, collapses and falls down. What do you do when a person faints? Immediately what you are supposed to do? Okay, okay. They feel faint first. Make them lie down because you can decrease the injury by keeping him lying down. Then I said, the blood tends to go into the dependent area. When the patient is standing, blood supply to the brain is decreased. When the patient is lying flat or supine, blood supply to the brain is increased. So most of the people just after lying, keeping them flat, will regain consciousness in few minutes. So again after few minutes also they didn't regain consciousness. What you do? Patient is unconscious. If you give water, he'll aspirate. This is what happens. You learn from movies such wrong concepts. You have to lift the lower limbs or legs up with the help of somebody pulling it up or keep some pillows under the leg below the knee like that, so the legs will be lifted up, so more blood will be going into the brain rather than lying just flat. If you lift the legs more blood will be going into the brain and the patient awakens. Even then if the patient is not awakened, then take to hospital, check his blood sugar levels if possible, or take to hospital where the provision is available. So, take home message, taking the right action quickly. Quickly is very important to save the golden time. And confidently, you should not panic. When you are confident, revise all the steps that I have told you now. You just revise once you go to your place, then you develop confidence. If you are confident, you will be able to give effective compressions. If you are not confident, array, how many should I give? 30 or 10? How many should I give? After 30, should I give 1 rescue breath or 2 rescue breaths? If you are having such doubts, instead of giving compressions, you will be blank and you won't do anything. So it should be quick and confident. That can make the difference between life and death for a person dealing with emergency situations. Why life and death? Timely, quick action in time can save the person. So I have come across a viral video these days. A young doctor in Vijayawada, you must have seen in social media. She has done CPR to a baby on road itself. a baby, a victim of electric shock. Parents were taking the child on their shoulders. They were crying. This doctor, when she was going on road by her car, she stopped and asked what happened. Then they said this is the scenario. She immediately made the patient lie on road and started doing CPR. Somebody recorded and posted in the social media. So she gave few cycles of CPR till the patient got the pulse. So instead, if the parents would have taken the child to hospital, the golden period would have gone. So her timely action saved the life of the patient. And you people are no more less. Now I expect you all are confident enough to deal with CPR and BLS. Are you? What will you do if you find some unconscious, unresponsive patient? Yes? Not heartbeat. You need not do heart. You need not check the heartbeat. Check for. Yes, good. First circulation, next airway, next breathing. Check for pulse. No pulse. CPR. Start compressions. Okay. Compressions. 30 compressions. 2 breaths. 5 cycles. Switch positions. Like that. 100 to 120 per minute. Okay. Till the patient regains consciousness. Okay, just don't leave the patient. Meanwhile, you have to call the ambulance and all, and they will be taking over the case. Yes,
Ma'am, what if we do the CPR rate?
it will be ineffective. You do fast. You are not giving adequate time for recoil of the heart. That's why we are given certain limitation. Yes, any questions?
What is the cause for nose bleeding?
Nose bleeding, there are many causes. Most common cause is the picking of the nose frequently. Nose is a structure which is very vascular in the body. So there are a lot of capillaries in the nose. Kids will be without their knowledge, they will be doing nose picking. So they will be damaging the mucosa and the capillaries. In certain conditions, when it comes to adults, in severe hypertension, the blood pressure rises so much, the blood flow to the capillaries increases and the capillary bursts. In that case, you will have continuous bleeding and it's a medical emergency. You have to take the patient to hospital as soon as possible.
How can we avoid that?
You have for adults, they need to check their blood pressure continuous, like for every month or whatever it is. If the blood pressure is under control, that hypertension cause is ruled out. For kids, you should not allow them to do nose picking. Yes.
Actually, I attended one workshop based on this CPR in
BLS.
medical hospital.
Okay.
Recently. And they said that there is an equipment which is used in CPR,
Okay.
which give electric shock.
Defibrillator, that is ACLS, that is another course, Advanced Cardiac Life Support. That is not for kids, cannot understand, that's a big subject. So in that case, we'll have different types of rhythms in the heart. It's shockable rhythm, non-shockable rhythm. For shockable rhythm, you have to have minimum knowledge whether to know whether it is shockable or not. There are certain conditions called ventricular fibrillation, tachycardia and all that, where you have to give shock. So in that case, the heart will be contracting like this. Instead of like this, it will be contracting like this. So blood will not be coming out. So when you give shock, no, then you are stunning that. Then it starts contracting normally. That is the device called defibrillator. That is again ACLS, Advanced Cardiac Life Support. If you are interested, you can do that course as well.
My name is Ketan. Can we get nose bleeding due to heat?
I can't see.
Sir. Yes.
Okay, okay.
Ma'am, can we get nose bleeding due to heat?
Okay. No. In dehydration, it can happen. Any more doubts? Yes.
necessary to wake a person who is unconscious or fainted?
Yeah, otherwise you will not know no, whether he is really unresponsive or just sleeping.
Okay, thank you, ma'am.
Ma'am, so if the brain, as you said, if the brain is arrested, so the brain will work for 4 to 5 minutes right now, ma'am. So what happens to the other organs in our body?
Every organ has got its own time limit for it to be revived like that. So brain is the most important organ which takes over major functions of the body. So the brain is the thing which degenerates quickly. So that is the time we have set maximum of 4 to 5 minutes. Rest of the organs will be surviving for a longer time.
Okay, ma'am.
Ma'am, can it happen so if the brain can shut down in less than 4 minutes?
No, usually it's not. Many studies have shown that 4 minutes is the time.
Ma'am, can we faint due to nose bleeding?
You can, when the bleeding is so excess that the blood loss is more, like I said, no, in case of severe hypertension, when the issue is not addressed in time, the bleed like so much, some 500 ml, like that also can be lost. If that much amount of blood is lost suddenly, the person goes into shock and collapses. They can faint.
And ma'am, when people nosebleed, many people keep paper to stop the bleeding. Is that safe?
No, the easiest method is to apply pressure, no?
Yes, ma'am. Thank you, ma'am.
We do apply packs in the operation theater, gauze packs. That is more better than applying external pressure. That is in the hospital setting. We have a specific drug called adrenaline. We soak the pack in adrenaline and keep it in the nose so that the vessels get constricted and stop bleeding.
Ma'am, how can we avoid anesthesia?
Anesthesia, why do you want to?
Ma'am, I want to ask.
Anesthesia is the beautiful thing which makes the thing painless. Just in olden days, people used to do surgeries by making the patient unconscious. They used to beat the patient, make the patient unconscious. It's so brutal. Once the anesthesia is invented, the patients are lying happily without pain. It's a blessing.
Ma'am, how does anesthesia work?
There are different mechanisms, like it's a broad topic. There are different types called regional anesthesia and general anesthesia. In regional anesthesia, they will be numbing certain nerves only, which supply to a specific organ. Based on the type of surgery, we'll be choosing regional or general. In general anesthesia, the drugs which give intravenously in the vein, they go and act on the brain. That's how the patient goes into sleep, and certain drugs will paralyze the muscles completely and the surgeon performs the surgery well.
If there will be excessive anesthesia in the body, what will happen, ma'am?
I think the topic is not about anesthesia. Yeah, tell me.
If there will be excessive anesthesia in the body, what will happen?
The patient will be sleeping for longer time. Any more doubts? Okay, how was the lecture? I hope, thank you. I hope you will address the situation whenever you come across an unconscious patient. You're going to revise all the steps of BLS and apply them there and save the life. Okay? Thank you.